Charlie, would you like us here or up there? Here or up there? Here. All right, we'll sit here. Hi, everyone. Good morning. My name is Steve Bird. I'm the president-elect for the Society for Emergency Medicine, for Academic Emergency Medicine, and I'm really happy to be here and share our progress for our research data and metrics work group. And before I get started, I'll just take a minute and kind of explain my journey very briefly. Some people here have heard it. As part of my professional development, my CEO and my chairman hired a coach for me, and my coach did an extensive 360-degree evaluation of me. Spent hours and hours doing that, and of the report, the first 3 lines of the report were, Steve looks terrible, Steve is carrying the burden of the department on his shoulders, and the last line of the intro was, I'm worried about Steve. And that was the beginning of my journey to wellness. And I figured if I wanted to be the best physician possible, if I wanted to be the best husband possible, and the best father possible, that I needed to take care of myself before I could take care of other people as well. For that. We'd like to thank members of the Research Data and Metrics Work Group. As you can see, the members represent a diverse array of constituents and interests. And we'd also like to thank members of the National Academy of Medicine staff, Charlie, Alexander et al., for all of their work in helping to make this possible. The Research Data and Metrics Group has convened over the past year in an attempt to positively affect healthcare delivery by promoting the well-being of healthcare professionals at both the individual level, where most work occurs, but importantly also at the organizational and the system levels, through critical analyses and synthesis of published research and the development of a research agenda in order to address the evidence gaps that exist. The Research Data Metrics co-lead, Dr. Bob Harbaugh, and I will spend a few minutes kind of highlighting what the ongoing progress of the work group and what the successes have been. The Research Data Metrics Work Group has written and published, or has written 4 manuscripts. The first, which many of you may know, entitled Burnout Amongst Healthcare Professionals, a call to explore and address this under-recognized threat to safe, high-quality care, was published by the National Academy of Medicine in July of 2017. I asked for data on it this morning. It is currently, appears to be the number 2 downloaded perspective piece ever at the National Academy, and has been read over 21,000 times. This paper addresses the increasing rate of burnout amongst physicians, nurses, and other healthcare professionals. The paper also explores the implications of provider burnout on patient safety and quality, as well as patient satisfaction. It addresses burnout in provider-clinician turnover and reduction in work hours. We know that clinicians that are burnt out are more likely to turn over, leave their job. They are less likely to be engaged in their job, and when they are in their job, they're actually working fewer hours. So there's tremendous implications. Also, the healthcare costs and the personal consequences of burnout, and addresses the main drivers of burnout while highlighting the research gaps and proposing suggestions for moving the science of burnout and well-being forward. So this has been a tremendous success. It's been out for less than a year, and I encourage you all to read it. The Research Data Metrics Work Group has also written a paper, what is not yet published, detailing the financial cost of burnout in nurses. And nurses represent the largest group of healthcare professionals in the United States. So that is forthcoming. That should be done next month. And in part due to increased recognition of sex and gender differences, a third manuscript, which is not yet completed, explores burnout and its related factors and the differences in diagnoses and manifestations between women and men. So I think we'll find that interesting. The fourth and last manuscript takes more of a pragmatic approach to provide information on which survey instruments to use in which context, and provides guidance on how to measure burnout and mitigation strategies at the local level. That in part is derived from the second task that we had, which was creating a clearinghouse, if you will, of validated survey instruments to assess work-related dimensions of well-being. So there are lots of instruments that are out in the literature, and so you culled that information, collated it, determined what would be best. And these instruments assess various things such as burnout, well-being, depression, and suicide risk. And some of those instruments include the Maslach Burnout Inventory, of which all of you are probably familiar, the Oldenburg Inventory, the Physician Work-Life Study, the Copenhagen Burnout Inventory, the Stanford Professional Fulfillment Index, as well as the Patient Health Questionnaire. And all of these instruments that I just mentioned, as well as some others, are available on the website. And it also has very important and good introductory text about what each instrument does, how to use it, et cetera, and there are FAQs for each of the instruments on the Knowledge Hub. So I recommend that you take a look at that. And lastly, and importantly, this list of instruments is being updated with new validated instruments. We're looking at a couple already. It will allow health organizations to plan, to measure, to intervene, and longitudinally follow the effects of their mitigation strategies on their employees. So those are the first two things that the Research Data and Metrics Work Group have been working on, and I'd like to turn it over to Dr. Bob Harbaugh now.
Thanks, Steve. The other two things that we decided to work on, one was to develop an annotated bibliography of interventions that were found to reduce burnout, improve well-being from recent, systematic reviews. And as we were planning that, we found out that the Collaborative for Healing and Renewal in Medicine, which has the great acronym of CHARM, had recently completed just such an annotated bibliography for physicians and physicians in training. So we reached out to them. They joined our effort, and it saved us a lot of time. We're doing the same thing now for nurses, and we want to do the same for other healthcare professionals, pharmacists probably being next in line. Eventually, we'd like to combine all of these and make them available as a resource on the Knowledge Hub. And then the final point is we've talked a lot about how do we assess what kind of impact the National Academy of Medicine Collaborative is having. So our first step in trying to do that is to develop a survey to assess the impact of this effort, as well as to gather information on organizational efforts to reduce burnout and improve well-being on healthcare professionals. And that should be ready to send out soon, and that completes our report.